Seltzer, we have talked before about the safe haven and the 360 plan for aging in place. And now that June has rolled around, our focus kind of comes on Father's Day, as it was last month. We were talking about Mother's Day. So it's a good
Yes.
time to talk about addressing the issues with our parents or maybe even grandparents who are getting older. And you go to the hospital, the first thing you say whenever the doctor comes in is when can I go home? So how do we get that conversation started about safe haven and making sure your loved ones are able to age in place?
That is a great question. The last time I was on your show, we talked about the statistic from the Gates Foundation, right? 97% of older adults want to remain at home, and 90% of the adult children, want to help them. And most recently, through the AARP, they say now more than 1 in 5 Americans, that's 21%, are caregivers and had to step up to provide care. So when you talk about someone being in the hospital and wanting to figure out the course, how do I get myself or my mom or my dad or my loved one home? The idea is to have a plan in place, to be proactive, because lots of times we end up waiting. If we have an incident or traumatic event and we end up in the hospital and we want to get home and we're trying to think of a plan, we might not be able to get to our home because we didn't really put the measures in place to support us safely and independently at home. So the whole idea with our safe haven, Dwell Assured, we created this so that we can really give a great resource, not only to older adults, but to all the adult children and loved ones out there who've had to step up, give them that peace of mind. And one way to do that is to get your loved one, get the older adult into a safe haven so that you have that plan and you'll know exactly what to do when you're faced with a situation or something unexpected, right? I was doing a webinar yesterday, and I came across this one woman said to me the most wonderful saying, and she said, "And ageism or aging doesn't have a due date, DUE." And I thought that was like the right approach to be proactive. When do you start something like this, right? When do you make sure you have a plan in place so that whether it's the older adults or the children, they know exactly what needs need to be met, because there's no time like the present.
It is really a good idea to begin doing that because I guess all of us, if we live long enough, we're going to be facing this kind of an issue. So I had a friend of mine who said he retired here to the mountains and he was already 80 years old. He said, "I have no clue why we build a split level home." So I said, "Well, you're going to have some planning to do if you're going to live in this home, because you're always got to go up steps to get from one place to the other. You're always going to be going up and down steps."
You're right, and the beauty of our safe haven being backed with occupational therapists and registered nurses, we want people to be able to remain in those beautiful homes. A lot of people, we work hard and we end up building our dream homes and retiring where we want to retire. But you're right, at that point, we're still thinking about living and doing. So we're moving into that split level or that mountain home versus thinking about just a rancher, right? A one level, that's easy, easy access, no step entry. But there's so many wonderful resources out there that can help a gentleman just like your friend to remain in their split level, from stair lifts to accessibility. It's finding the right service providers, and that's what's really great with Dwell Assured. We've done all that. We're taking the guesswork out. We have over 100 or so vetted safe haven providers, that one can feel very safe about with letting them into their home. We're not getting scammed. There's agreed upon prices. And we're kind of directing the plan and suggesting the steps to take. And then it's up to the individual what they'd like to do now or later. And that's the beauty of a plan. We're looking at now, and like with your friend, we're looking at his split level and saying, okay, you know what? when the time comes, these are the resources for a stair lift, or a stair glide. Or when the time comes, we got to rip out that tub shower and put in a seamless shower with grab bars. And this is the plan for now, a year, and 5 years from now.
But now you have individuals. You have the registered nurses who come in and do the checkups. So the certified nursing assistants or trained family members. But then also you have occupational therapists who can come in and help individuals develop that plan. And then also the follow-up. So you've got 4 steps in this Safe Haven plan, so that essentially the bases are covered, and you've got trained individuals who can provide the guidance as far as that is concerned.
Oh, Roy, you're right. And even more than that, it is. It's a 360 view comprehensive plan, and we built it, on 5 pillars. Because look, it takes so many resources and services to truly age in place successfully, to have that peace of mind. So we built our Safe Haven audit on, yes, looking at safety and security and health and well-being, home modifications and maintenance and finances, and just to bring, meaning and purpose. But yes, being backed by an occupational therapist, you're working with someone like myself with so many years of experience, especially with aging in place, that a lot of the recommendations and a lot of the ideas that we talk about are so economical and easy to put in place. They're sold at your local Home Depot or Lowe's or Ace Hardware stores or Amazon, that there's tricks of our trade that you can implement right away that can make such a huge difference to someone, even like accessible storage, or adding the right exterior grab bar outside just to help them be able to hold on to something as someone has to reach in for their keys, to unlock the door. Lots of times, believe it or not, that's when someone can lose their balance. And we've worked with plenty of people who have had falls just trying to get into their home. But yes, our RN follows up monthly. But not only that, yeah.
I was going to say in North Carolina, and I'm sure all the other states are covered by the Older Americans Act, but
yes.
Independent living and vocational rehab, and there are a number of sources, both with state and federal funds, which can help with some of those modifications.
Absolutely. We partner. We have national partners with durable medical equipment, elevator companies, accessibility with wheelchair and lifts and ramps, home healthcare companies, medical and non-medical, that we work closely with them to complement their services and make sure that, yes, an individual, it can be submitted for learning about either Medicare or Medicaid or long-term care insurance. We're all working together, right, for just an optimal outcome, for the best plan, individualized plan for that person or that family.
How is the best way that our listeners can get in touch with Safe Haven and you and the people
yes.
that you would work with to develop this plan?
Absolutely. Please visit our great knowledgeable website at safehavenforseniors.org. We have a lot of great information and resources, and on there is our phone number and email. And I welcome it. Anyone who wants to reach out and even discuss this further to see if this is right for them or their loved one. That's it's my passion. We just want to make sure that everyone enters our safe haven across our country.
Well, Rachel Seltzer, it's always great talking to you, and I appreciate what you all are doing, and I thank you for your time today.
Thank you, Roy. And yes, with Father's Day coming up, right? I know last time it was Mother's Day. What a great gift. Sometimes we never know what to get our dads. Other than a picture or maybe another mug, a Safe Haven membership, that's a great gift. That's a great gift to think about.
I agree with you.
Thank you.
All right, so you have a great rest of the week, okay?
Yes, and I'd love to come back anytime. Thank you.
Okay, well, we'll be in touch. Thank you so much. Bye-bye.
You're welcome. Bye.